I didn't come to medical school just to learn to treat disease. I came because I believe rural communities deserve more. More than the bare minimum, more than what the system has historically offered, and more than what it's then believed we all will settle for. That belief didn't come from textbooks. It came from the unspoken daily courage I saw growing up in Kentucky and West Virginia, and it's what keeps me moving forward. I'm Bradley Firchow, a medical student in the Rural Physician Leadership Program at the University of Kentucky College of Medicine. I'm honored to receive the Quinn Student Award from the National Rural Health Association, not for any one achievement, but as a reflection of the people and places that have shaped me. The most formative part of my training hasn't come in simulation labs or lecture halls. It's come from starting a rural, student-run free clinic in Eastern Kentucky, alongside a rural homeless shelter. There, we care for patients who have been told, directly or indirectly, that their pain is less urgent and that their lives are less worthy of saving. But what I've learned is that trust is its own kind of medicine. Our clinic is run by 24 students, but it functions on something deeper. The belief that care can be rehumanized, and that rural spaces can be places where healthcare doesn't just reach people, it belongs to them. As chair of NRHA's Student Constituency Group, I've advocated for student voice in rural health policy. That work has included going to Capitol Hill to advocate for the creation of the Office of Rural Health at CDC, a step toward acknowledging what rural health leaders have known all along, that our communities are not outliers, but bellwethers. When rural health systems thrive, they teach us how to elegantly deliver care with respect and reciprocity. I've led our American Medical Association chapter, worked with the Journal of Appalachian Health, and published policy and narrative writing in places like The Lancet and Salvation South. But I've never seen those as credentials, only as tools. Tools for elevating rural voices, for shifting policy upstream, and for reminding the next generation of rural health leaders that the status quo in rural is far from enough. This award is not just a milestone, it's a mirror. It reflects the moral labor of patients, mentors, and neighbors that taught me that care means present, that advocacy is a type of love, and that leadership at its best looks a lot like listening. I believe rural medicine is where the sacred and the practical meet, where data meets dignity, and where our collective future will be decided not by how loudly we shout, but by how faithfully we see ourselves in each other. It means the world to me to return to Atlanta, just down the road from my alma mater at Oglethorpe University, to accept this award, and to imagine with all of you what's possible for rural.